I want to clarify something regarding the hantavirus situation. So here's my research. Hantaviruses are a family of rodent-borne viruses, genus Orthohantavirus, that can cause serious, sometimes fatal disease in humans. They are primarily zoonotic, meaning they spread from rodents to people, usually via inhalation of aerosolized urine, droppings, or saliva from infected rodents, or through bites or contaminated surfaces. Rodents themselves are typically unaffected carriers. There are two main clinical syndromes: Hantavirus pulmonary syndrome, HPS or HCPS, predominant in the Americas, New World hantaviruses. It causes severe respiratory distress, fluid buildup in the lungs, non-cardiogenic pulmonary edema, and can lead to shock. Fatality rates are often 20 to 40% or higher in some outbreaks. Hemorrhagic fever with renal syndrome, HFRS, common in Europe and Asia, Old World hantaviruses. It primarily affects kidneys and blood vessels, with symptoms including fever, bleeding, and potential kidney failure. Fatality is generally lower, 1 to 15%. No specific antiviral treatment or vaccine exists for most cases. Care is supportive. For example, oxygen, fluids, ICU monitoring for breathing/heart/kidney issues. Early medical attention is critical, as the disease can progress rapidly. Focus on Andes virus, ANDV. Andes virus, found mainly in Argentina, Chile, and parts of South America, is notable as the only hantavirus with documented person-to-person transmission. This is rare and typically requires close, prolonged contact. For example, household, intimate partners, or caregiving, often involving respiratory droplets, body fluids, or shared items during the early symptomatic prodromal phase. It is not casually airborne like flu or COVID in everyday settings. Transmission details. Primary route is still rodents. For example, the long-tailed rice rat, Oligorozomus longicaudatus. Human-to-human spread has been confirmed in outbreaks via epidemiologic tracing and genetic sequencing. Examples include clusters where one index case, often after rodent exposure, infected others at social gatherings. High viral load and liver involvement in the source patient may increase transmissibility. Super spreader events have occurred at crowded parties. Incubation, usually 1 to 8 weeks, can be 4 to 42 days for Andes. People are typically infectious only while symptomatic. Symptoms: start flu-like, fever, headache, muscle aches, especially in back/thighs, fatigue, nausea/vomiting, diarrhea. Progress to cough, chest pain, shortness of breath, and rapid pulmonary edema/respiratory failure in HPS cases. Some have gastrointestinal issues early. Mortality for Andes/HPS. Often 30 to 50% in severe cases, though overall case fatality varies, around 20 to 40% reported. Not everyone progresses to severe disease. Key outbreaks. 1996, El Bolson, Argentina. Early evidence of human-to-human spread. 2018 to 2019, Epuyén/Chubut, Argentina. 34 cases, 11 deaths, after a birthday party index case, driven by a few super spreaders at social events. Reproductive number dropped with control measures. Recent, 2026, cruise ship, MV Hondius cluster, linked to Andes strain after departure from Argentina. Multiple cases/deaths with suspected human-to-human elements. Global risk assessed as low by WHO. Some systematic reviews question the strength of evidence for routine human-to-human transmission, noting biases and possible co-exposures. But multiple well-documented outbreaks with genetic confirmation support it for Andes specifically. That is my clarification on the hantavirus, Mapsino Red X, out.